So I'm Fatima Dakra, and I'm originally from Pietermaritzburg, born and brought up that side, and then I came and studied medicine here in Pretoria. I then went on to further specialize at Tufts University, and I did general surgery. And then since then I have joined at Krugersdorp Netcare. My special interest and my passion is breast cancer. So at Steve Biko, I used to run a breast unit there, and we used to see hundreds of women who used to walk in with the breast cancer. We used to try and offer them a good service, which they didn't have previously, where on a Friday they used to come, walk in, have a mammogram, see a specialist, and management gets decided for them on the same day. Myself and Dr. Breitenbach, our plastic surgeon, we have started a breast unit in Krugersdorp. This is one of the first in this area. Both of us being female surgeons, we would like to bring a new dynamic to this area because we're one of the first few female surgeons in the area. I'm the second female surgeon to have joined Krugersdorp Netcare. The other doctor is Dr. Matitela, the gynae. Both of us are passionate about breast cancer. From my background at Steve Biko, where I ran a breast unit, she comes from George Mukari, where she did her plastic surgery, but she's had extensive experience in breast surgery, even in the Johannesburg circuit. Both of us, we complement each other in the sense that I do the general surgery where I remove the cancer, and she goes and makes things look pretty again afterwards. So Saturday, we basically wanted to bring awareness. We wanted to bring ourselves out to the public so that they could directly approach us, because often people find that it's difficult to come and see us in the hospital to approach a specialist. If you go to a government hospital, it takes a lot for you to eventually reach a specialist. Whereas in our setting, people don't have money or medical aids to come to specialists. We wanted to take ourselves to the public basically, and that's what we did on Saturday. We were approached by a lot of people who had simple questions about breast, but they didn't have the right people to ask. So this was the first time that we did something like this, and it will be the first of many. Due to COVID, obviously we couldn't do as much as we would have liked. We were also planning a park run, maybe that will be for 2021, but this is one of the first of its kind. But also, even though we're in a private hospital, we are saying at Krugersdorp Breast Unit, we are not limited to the private setting. We are bigger than our private setting, and we want to help everyone with a breast problem. We are partnered with the Reach for Recovery and Can Survive for our breast cancer awareness, and we've already raised a substantial amount of money which will be going to both charities. Throughout the month of October, we've actually started planning way in advance, where we started with a team of our sisters in our hospital and our hospital manager, and just basically our staff and their families. So we have been running a few projects during the month. So every Friday we wear pink in honor of breast cancer, and we pay 5 Rand to wear the pink clothes. So all our staff wear 5 Rand to wear. We also have sold t-shirts, caps, buffs, all that with the profit going towards our donation. We also have many people have just given cash money also as donation, but these are all staff of the hospital. We also started another new thing that we would like to continue throughout the year, is we're calling it our pink box of love, or some people calling it our glitter box. These are boxes especially created for breast cancer patients. So anyone undergoing any sort of treatment, either in private or government, will hopefully receive a box. And in the box are specially thought out items that were thoroughly researched of what a breast cancer patient might require. Like one of them is a seatbelt cover. After a mastectomy, where the breast is removed, the patient has a scar on the chest wall. They find it painful to often wear their seatbelt. So they have a little cover for the seatbelt just to try and cushion that area from the harshness of the seatbelt. So these boxes will be donated also in all settings, government and private.
We decided to do the pink glitter feel-good boxes for patients, which is for post-mastectomy patients. So just to give them a gesture that somebody is caring of them, and to them somebody is aware of what they're going through, and just to emotionally support them. We've got a seatbelt cover, which is actually with Velcro, and that will help you to prevent you from the scar. If you put it on your seatbelt and you have then protection against your body. We've got a nail buff here, which is for the people that get all the ripples on their nails, and just to make it smooth and nice. Just something for a tissue if they go and they are at the oncology if they need it. A little bit of hand sanitizer which is in there. Then we had a sponsorship of Future Life just for them if they need it or on the run and they feel that they need to eat something. There is that. Quite a lot of our patients do have hair loss, especially on the eyebrows, and this is just the eye pencil, brow pencil that they can actually help them to look pretty again. We've got a sponsorship from Bonitos, which gave us some of our face masks, a little bit of a little water bottle that they can just fill up and have with them. You know, if they are driving around, it's small enough to fit into your handbag. So if they are thirsty, and just a small token of a tea bag, which they can just on their way also have. You can make it cold or hot. We had some of our staff crocheting for them little angels, which they can use in their Bibles or as a book mark, or just to keep around them that they know that somebody is looking after them while they're going through the difficult time. Sponsorships that we had also. This is a hand wash that you don't need any water, so as they go along that they can have that. We also have in some of our boxes, we have scarves, so not all the boxes are exactly the same. A nice looking scarf that they can actually put around their necks, or when hair loss comes that they can put around their heads, or they can use it as a belt. In this box we specifically also have a notebook for the oncology. They normally have to make notes. There's a pen available to them. There's something just to suck on, and then there's a lip balm for the dry lips as well, and then also a hand sanitizer. Sorry?
This box we're having some cream for them, and some bath salts, and this one is also having a little booklet for notes, hand sanitizers, the angel, and the pen, and a nail buff. So on Saturday we sold some t-shirts. We also had Reach for Recovery with us, just to bring awareness to all the good work that they do. But basically we wanted to talk to the public, we wanted to educate them about the risk factors of breast cancer and offer them any advice if they had any questions. We have been seeing a few patients already from Saturday, and we've had some surprising diagnoses already. Also, as part of our campaign, we are offering 40 free breast examinations amongst us surgeons. So it's myself, Dr. Breitenbach, Dr. Mulder, and Dr. Mutambi. The other two are also general surgeons we will be offering. Each one of us will be doing 10 free breast examinations. So patients will be allowed to come into our offices, see us, be examined from us, get advice from us. Our mammogram department have also come on board. They are giving 10 free mammograms to patients that we have selected. We've already done a free breast biopsy. Our labs have come on board offering free pathology services. So if anyone has anything suspicious in the breast, we do a biopsy and then we send the specimen away to the pathologist who then looks at it.
When we do mammograms, we do 4 views. We call it cranioportal view, so it's 2 mammograms from the top, and then mediolateral views, which is oblique view of the right breast and then oblique view of the left breast. So for those ones, we compress the breast. We put the breast on this is what we call the receiver, image receiver. We put the breast on here in the middle, and then we compress with this is the compression plate. And then you compress as much so that the breast is taut. If the patient is experiencing a lot of pain, you stop. You feel with your finger to see that you are happy. And then you expose, you go to the back and then you expose. The patient is compressed for a short while. And then you expose. And then you go over and you do the left side. And then once you finish with the cranioportals, you go onto the obliques. For the obliques, you have to tilt the machine to the angle of the patient. You have to assess the angulation according to the patient's body shape. And then for that one also, you position the patient with the breast on the plate and then compress as well. We must make sure that the patient's shoulder is relaxed. It's very important so that we get the pectoralis muscle on. And this is the most important view because it shows everything under the armpit as well. And then you compress the patient also for a short while, go to the back and expose, and that's it. After that, when the patient is finished, you ask the patient to just have a seat, you have a look at your images and you send it through to the doctor and you explain to the patient that you're going to go for an ultrasound of the breast as well.
Well, the one goal that we want to reach is we want to reach 50,000 rand of that cash donation that we will be giving out. We are close to that. We are still doing our final numbers. Last year we raised 17,000 within 1 week of work. This year we've already far gone past 17,000, but we will have our final numbers next week on the 28th when we will be giving out our donations to Rich for Recovery and Can Survive. The other thing is we wanted to just raise the awareness, and I think we've definitely done that. We've met many women over the age of 40 who have never had a mammogram before. They didn't know the ins and outs of how to get a mammogram. We also distributed a few forms for patients to go and come here to have the mammogram. The other thing to mention is that we reduced the price of our mammograms. Our cash price is 1,250. So anyone can come, and the offer is standing till the end of November where they can come and have a mammogram. So for breast cancer, the important thing to remember is that it's more common in females. So one of the risk factors is definitely being female. It does happen in males, but not that often. But any man who has anything suspicious in the breast should immediately seek help. All women over the age of 40 should start having breast screening, so start having mammograms. Medical aids pay for the mammograms, and in the government settings there are facilities in place to provide mammograms. And I say this knowing this because I worked in a breast unit in a government setting. Anyone over the age of 40 should start having a screening mammogram, but if you have a positive family history, that obviously increases your risk of breast cancer. So then you should start earlier with either an ultrasound of the breast. If anyone notices any changes in their breast, such as a lump, skin changes, nipple changes, swelling under the arm, they should definitely go and seek immediate help. Well, they can either start with their family doctor because it's someone that they are familiar with, but otherwise they can see general surgeons normally deal with breast lumps. So make an appointment with your general surgeon, get seen by the surgeon, and then from there, depending on your age and the density of your breast, a decision will be made for either an ultrasound or a mammogram. Generally, we would prefer a mammogram. We would then refer the patient for the mammogram, and once the lump is seen on the mammogram, they will tell us how suspicious it is. So we use something called a BI-RADS classification, and that will grade the findings of the lump. And once we have that, then we decide whether we should do a fine needle biopsy or a true cut. We prefer a true cut biopsy, which is a bigger needle, and we send away that specimen to the lab. And only the pathologist at the lab can make the final diagnosis of whether it's a cancer or not a cancer. And then from there, the patient comes back to the general surgeon, and then decisions are being made of what should be the next step. The main emphasis on breast cancer that we would like the management for breast cancer is nothing is decided by one doctor. We are a multidisciplinary team, especially at Krugersdorp here. We have a multidisciplinary team, we have meetings, we discuss each patient. So no patient has any management without discussion by the team. The people who are part of our team is the general surgeon, the plastic surgeon, we have a medical oncologist, our radiation oncologist, and then a very important member of the team is our psychologist. Because this is very traumatic for the patient to find the lump, to think they have cancer, then to be given the diagnosis of cancer. The psychologist plays a huge role. On top of being given the diagnosis of cancer, then you are faced with making decisions of what you should do with your cancer, what type of operation you should have, whether you should have a reconstruction of the breast. That's where our psychologist plays a huge role. Our psychologist that we use is Dr. Divantir, and she works with a lot of breast cancer patients, and she plays a very vital role in our team. So once a patient is diagnosed with breast cancer, they are a patient that we walk on a path. I always tell my patients, we are now walking on a path, and I'm here with you to walk every step of the path. Because once we have success at the end and we've removed the cancer and we are happy that the patient has completed their chemo, or if they needed radiation, they do require follow-up in the future. And that's where we play a role. So patients, we normally follow them up every 3 to 6 months. They will either follow up with me or the oncologist, but we definitely do follow up the patients as they go on. Part of our breast campaign is that us as the doctors, we are there, but we're not forgetting every person who played a huge role in this. One of the special mentions will be Sister Marti, who last year played a huge role, and this year she has taken time, effort, and put all her energy into creating the pink boxes, and has also gone around and sold items and has pushed the whole hospital to raise the amount that we will eventually have next week. All our physio teams have also come on board. They have donated money, they've donated the boxes, and more importantly, people donated their time on the Saturday to come to the event, to speak to the public and to raise awareness.